look, there's Dr. Loh. Hi, Dr. Loh.
Hi!
You ready for a quick interview?
Come on, let's go.
Firstly, what is PCOS?
So PCOS is a condition whereby the patient will have ovaries which are larger than usual, and normally because your ovaries are a bit larger, you might have a hormonal imbalance, and sometimes they're also associated with some medical conditions.
So, doctor, can you share with us on what are the symptoms of PCOS?
So PCOS can present in many ways, but the most common reason that people present to us with PCOS is that they have got irregular periods or no periods.
Is PCOS due to genetics or lifestyle?
It's definitely genetic. Unfortunately, you're born with it.
Doctor, can PCOS happen to teenagers?
Yes, it can. It can happen to women both in the teenage phase and also in the adult phase as well.
When should one worry about PCOS?
PCOS is something that you should worry about if your periods become very irregular, if you're not having a period for more than 3 months, or if you're having excessive hair growth on your face, or if you're having excessive acne.
Can a person still get pregnant with PCOS?
Of course you can get pregnant with PCOS. The only problem in PCOS is that you may not necessarily be releasing an egg every month. So what I advise is that if you know you have PCOS and you have plans to get pregnant, you should probably see somebody, your gynecologist, to check and see what your status is.
Oh look, Dr. Loh is back. So doctor, let's continue. Is there any cure for PCOS?
Unfortunately, there isn't.
How is PCOS diagnosed?
PCOS can be diagnosed by doing a few things. One of the things that we can do is obviously to take a history and find out how regular your periods are. Secondly, we will do a scan to look for polycystic ovarian changes. So basically polycystic ovaries, meaning big ovaries with lots of little follicles. And lastly, we actually look for other signs of hormonal imbalance as well, such as excessive hair growth or acne.
So what are the treatments for PCOS?
The treatments for PCOS will depend on what symptoms you're having. If it's problems with fertility, then obviously fertility treatments might be necessary. If it is problems with your periods, we might have to give you some hormonal treatments to sort of regulate your periods. And if, let's say, you're having problems with excessive hair growth or acne, we might need to give you some medications to try and reduce the male hormone in your body.
So doctor, random question, we're curious. What do you like to do after work?
So after work, I like to go home, spend time with my kids, do some baking sometimes, some cooking. Sometimes, if the weather permits, I like to do some gardening as well.
Wow, interesting. Are all PCOS patients overweight?
Whilst the majority of PCOS patients are thought to be overweight, there is actually a subgroup of these patients which are of the normal weight.
Can a teenager outgrow PCOS?
Unfortunately, you cannot outgrow PCOS. Once you've had PCOS, it kind of stays with you. However, if teenagers control their weight, then actually they will probably have minimal symptoms and regular periods.
So what other possible medical problems should I be worried about if I have PCOS?
So PCOS actually can be associated with a few metabolic symptoms. Yes, you have the hormonal aspect, but it is also associated with an increased risk of diabetes. In some patients, they have an increased risk of heart disease. And there's also an increased risk of something called obstructive sleep apnea, meaning that when you're sleeping at night, sometimes you stop breathing. Now, these are all quite dangerous conditions which need to be controlled. In some circumstances as well, PCOS is also associated with depression and poor body image because of, for example, the excessive hair growth, the acne, the weight gain as well. If you are having symptoms such as these, it's probably best to see a doctor and make sure that you optimize that.
Can pregnancy cure PCOS?
Unfortunately, there is no cure for PCOS.
One last random question. What's the one thing you can't live without?
One of the things that I cannot live without is probably my eyeliner, because I love that. Thank you very much for joining us today, and we hope that we've given you some valuable insights on PCOS.
Thank you so much, Dr. Loh.